For Sally Casper, a trip to the local dog park was once a stressful and unpredictable exercise.
Just out of the blue, your body tells you, I've got to go to the bathroom now. It's just all-encompassing. You don't think of anything else but, how will I get there? This terrible fear that, will I make it in time? It's just dreadful.
For 30 years, she struggled with irritable bowel syndrome. How often might this hit you?
At its worst, before I'd go out in the morning, maybe 3 times that I'd have to go to the bathroom, and perhaps after lunch another couple of times. Again in the evening, I might be just ready to go out and all of a sudden I'll say, like, wait, I've got to go back inside again. And out we'll go, and again. So, yeah, it's too much, way too much, which is an awkward thing. So nobody actually knew. It was something I controlled. It wasn't something I discussed with anybody. You keep it to yourself. You're pretty private about having irritable bowel.
Sally Casper might have suffered in silence, but she's definitely not alone.
Probably 10-15% of Australians will have it at some time in their life, so it's very, very common. It's the second most common cause why people will not be at work, absenteeism. And when you're at work with it, you don't work as well, so we call that presenteeism.
Professor Peter Gibson is a globally recognised expert on IBS.
IBS is a condition where people get bloating, abdominal pain and change of bowel habits over a long period of time. They might get it 3, 4, 5, 6 days a week, even 7 days a week they get the symptoms. And it goes on and it goes on and on. So it's a chronic condition.
So do we know what causes it?
Some people it's brought on after a very major stress. But many people it just occurs and we can't find anything to blame.
Professor Gibson and his team at Monash University developed a diet which has provided relief for thousands of IBS patients. It's called the low FODMAP diet and eliminates certain carbohydrates.
Zooming in to the molecular surface of the intestinal cells, we see they are covered in molecular machines that accelerate the breakdown of carbohydrates. Some carbohydrates are not digested or absorbed by people. The rapidly fermentable short-chain carbohydrates that can't be absorbed are called FODMAPs.
And they bring more water into the bowel. They also get fermented to make more gas. So in all of us, what they do is they stretch the bowel wall, and that's a major stimulus for symptoms if you've got a sensitive gut. In other words, if you've got IBS.
Now there's another treatment proving equally successful.
I've never had hypnotherapy in any way before. I've seen it at a hen's night. I thought, but that wasn't what I was going to have.
Well, if I'm honest, I don't think hypnotherapy was probably something that I was all that interested in when I first started in the area.
Powerful changes are happening inside your body. This medicine is doing you so much good. Soon you notice that you can feel this medicine travelling further down into your intestines. It leaves a strong protective coating.
Sally Casper tried medication, alternative therapies and diet changes without much success, so decided to try what's called gut-directed hypnotherapy, consulting Dr. Simone Peters.
You no longer feel sensations of pain, bloating or discomfort. Your bowel habits are normal.
Hypnosis itself is really just a state of relaxation, and once we get somebody into a really nice deep state of relaxation, the aim is to provide suggestion to that sort of subconscious part of the mind. And I guess the key thing about gut-directed hypnosis is that that suggestion is made toward controlling gut function.
What difference did it make?
Quite dramatic. I only ended up having, you have 5 sessions over, let's say, a weekly basis if possible. I think an 80% improvement, which is miraculous. I'm really excited about it.
The team at Monash Uni carried out a study which compared the impact of gut-related hypnotherapy with that of the low FODMAP diet. The results were dramatic.
So we found actually that after 6 weeks of treatment, 72% of participants had improved with regard to their global gut symptoms following hypnotherapy.
Why does it work?
Good question. We don't know exactly how it works, so mechanistically we don't know exactly what is causing this improvement, but we do know that there are changes from both a psychological and a physiological perspective.
And soon you notice that you can feel.
And it's equally as beneficial as the low FODMAP diet. So the low FODMAP diet is now considered the gold standard with regard to dietary therapy for irritable bowel syndrome, and we can show that in fact that hypnotherapy is just as beneficial as the low FODMAP diet. But I think that the really key thing is that people actually don't need to change their diets when they do the hypnosis.
As Professor Peter Gibson and his team continue their research, they also hope to better inform general practitioners and increase the number of people trained to treat those with IBS.
Our registrars, who are the training gastroenterologists, get active training in irritable bowel syndrome. In the past, it's been a little bit more passive.
Sally Casper feels so liberated that she's now happy to talk about what was once her inconvenient secret.
It was remarkable. I wouldn't have believed that it could work so effectively. There can be relapses. It's not, always perfect, but in comparison to how things were for me, it's amazing.